Hello, and thank you very much for watching my channel. This is the first of what I think will be a series of presentations about the developing pandemic with COVID-19. Hi, I'm Douglas Deutschman. I have a picture of myself there. That's my RNF, my resting nerd face. My qualifications for talking about this: I have a PhD in mathematical biology and a master's degree in statistics. I have about 30 years experience teaching biostatistics at the university level, and I've got experience analyzing data from a variety of systems, most in conservation biology and in medical research. So I have been spending a lot of time following this outbreak, reading the scientific literature and trying to understand how quickly and how badly this might get. So as of today, which is March 16th, COVID-19 has infected at least 181,000 cases that have been confirmed. COVID-19, we think, migrated into humans sometime in December. The World Health Organization started publishing updates about it in mid-January. We're in mid-March, just 2 months after we started looking at this disease, and we have 200,000 people nearly that have been confirmed to have the disease. Today in San Diego County, where I am right now, we got an alert from the health department that they're putting into effect a series of emergency regulations, shutting down the dine-in restaurants, limiting events to less than 50 people. All of the schools have closed. These are all measures to try to decrease the speed at which this is sweeping through the world. So what do we know about COVID-19? Well, one thing we need to understand about any new epidemic is the case fatality ratio, the CFR. It's the proportion of individuals who die once they've been infected with the particular virus. The case fatality ratio, the CFR, is very hard to calculate in the early stages of an epidemic for a variety of reasons. It's very difficult when there's a new disease to make sure you actually get accurate numbers of diagnoses for who has the disease. There's also issues with time delays before you see case mortality and with an accurate count of fatalities. The case fatality ratio is estimated to be 1.5 to 3% in China. That's very, very bad relative to something like influenza. Data from Iran and Italy are worrisome. They're worse. The case fatality ratio appears to be something much closer to 6%. From what we can tell across multiple outbreaks that we've been following, it appears that 15 to 20% of individuals who get the disease need some sort of medical support. The good news is about 80% of the people get fairly mild disease, or some might even not even know they have the disease. The symptoms may be mild or missing altogether. But again, about 1/5 of the people, 1/6, need some sort of medical support, and perhaps 5 to 10% need hospitalization. Most of the patients that need hospitalization need to be treated in the intensive care unit for acute respiratory distress syndrome. So that's going to be a pneumonia where you're getting materials building up in your lungs, fluid building up in your lungs, and without ventilation and oxygen in an ICU, it will most likely be fatal. So if this epidemic is growing quickly, we're likely facing a shortage of intensive care unit beds and ventilators all across the world. And many people talk about the flu. This is much worse than the flu. It's much more virulent, maybe 10, maybe 20 times more virulent than the flu. What is the reproductive rate of COVID-19? R naught is the reproductive rate. It's a measure of how contagious it is or how fast it's likely to spread. Like the case fatality ratio, the R naught, it's hard to calculate in the early stages. The initial estimates from China suggest that R naught is maybe 2.5 or 3, meaning that on average, every infected person gives rise to 2 or 3 other infected individuals. At that rate, in China, the epidemic was estimated as having a doubling time of 6 days. 6 days is a very quick doubling time. It means if we have 100 people infected today, in 6 days we'll have 200. And then it'll double again 6 days later, we'll have 400. And then 6 days later, we'll have 800, and it'll keep doubling. Well, that's not the bad news. The bad news, the current doubling times in Europe we're seeing is around 3 days. So if you look at the data over the last 10 or 15 days in Italy and Spain and France and Germany, we're seeing it doubling more than twice each week. So 1,000 becomes 4,000 or 5,000 within a week's time. And that itself becomes 16 or 20,000 in yet another week. So it's an incredible fast rate of attack, a fast spread. Again, many people talk about whether this is just some other flu. It is not. This is an incredibly fast rate of spread. It's spreading much faster than the typical flu. So we have a combination of a disease that spreads faster, that's more virulent, and that nobody is immune to because it's novel. None of us have ever seen this. So please do take this really seriously. So I'm going to show you some data. I analyze data. That's part of what I can contribute to this discussion. So I'm going to try to show you real data on the ground, mostly from Europe, in recent days. What I've done is I've taken data from March 1st to March 10th, so 10 days of data. I have raw number of confirmed cases in Italy, in Spain, in Norway, other places as well, but I'm going to show you most of the European countries where the outbreak is currently at its is most severe. And then I'm going to predict the rate of spread over the next several days. So I'm actually going to predict the rate that the number of cases we would see on March 11th or 12th up through the 16th, which is today. And then I'm going to look at how my predictions fare against the real data. If the predictions are fairly good, which is based on these exponential growth models, then we can probably make predictions 4, 5, 6 days into the future about how quickly it will spread. And we can apply those ideas to North America, to the United States, to Canada, to any place. And I think that what we'll find is that the models are simple. They ignore a lot of detail, but they actually capture the information fairly well. So when we model an exponential relationship, we model the relationship as a linear in a logarithmic transform world. So we take the logarithm of the raw numbers and we expect a straight line. That's a lot of math. If you don't remember logarithms or never learn them, that's fine. On the left-hand panel, what you're seeing is the real data for 10 days of confirmed cases in Italy in this logarithmic scale using the log base 10, if that means anything to you. All I want you to notice is that those points, those gray dots, which are the real data, truly do make up essentially a straight line. I fit two different models, one for the March 1st through the 10th, so the last 10 days of data at that point, and the other is March 6th through the 10th, last 5 days. The reason I fit two different models is it looked like in some countries the epidemic was speeding up or slowing down, and so the more recent data was more likely to be predictive. I took those regressions and fit them statistically and then predicted into the future. And so, for example, in this case with Italy, both models predicted that on March 17th, tomorrow, we would see 43 to 46,000 confirmed cases in Italy. So what you'll see is a series of countries in which we look at these predictions and evaluate their properties. So how well does this simple model work? I mean, it's as simple as could be. There's no biology. There's no anything except exponential growth. So again, let's look at Italy. We talked about that. The left panel is what you've seen before. The right panel is new. Those are actually in yellow. This little area here are 6 new data points from March 11th to March 16th that were not used in making this model. You can see that in this log transform metric that the values tend to drift slightly below the line. So the epidemic appears to be slowing down somewhat in Italy. We have a hard time thinking in log scale. Log 10 scale means that 2 is 10 to the 2 or 100 cases. 3 is 10 to the 3 or 1,000 cases. 4 is 10 to the 4, 10,000, and so forth. So little differences up here can actually be large numbers. So for us to evaluate this and understand really the magnitude, we need to put it back in the original metric. So here is exactly that process. Because I have data through March 16th, I'm now going to be talking about predictions through March 16th and evaluating this model. So on the left, gray dots, raw data. Blue and red line, predictions from raw data. Black dots, new data that were not used to fit those lines. How well do they fit? As you see on the left-hand panel, the points drop off a little bit. It's actually more obvious in the raw data what that looks like. So on March 10th, 6 days ago, we had 10,000 cases. As of today, we have 27,980. So we've gone essentially from 10,000 cases to 30,000 cases in 6 days. That's an appalling increase in individuals. The interesting thing is that's actually a slight slowing down of the rate that we were observing in Italy previously. So that increase of 20,000 or so individuals being infected with this disease is actually an improvement over what we might have expected a week and a half ago, which is terrifying. Here's the same kind of information for Spain. Again, gray dots, 10 dots, data, red line, blue line, two different models, black dots, the real data. So on March 10th, we had 1,695 cases in Spain. On the 16th, I predicted we would have 9,600 to 14,000. We had 9,942. So the predictions weren't too bad, and it was closer to the blue line, which means the last 10 days of data appeared to be a better predictor of spread. Although, look, it did deviate from this line a bit. It got faster and then slowed down. There's a lot of issues with testing and whether we're testing enough to really know the true rate of spread. And if countries start testing more and ramping up their testing, we see an increase, a sudden increase in numbers because of that testing. So that's a thing that's lurking in potentially all of these data. Moving ahead to France, the gray dots you can see again are the data. You'll notice they fluctuate some. Here they've gone lower and upper. Again, I don't know if this is real transmission differences or measurement differences, testing, who knows. But I fit the two models to the data. We see that the data are better explained by the model of the last 5 days of spread. We had 1,792 cases on the 10th and 6,650 cases on the 16th. And my prediction was between 6,560, which looks like it's the same, but it's not. It's about 100 cases lower, up to 10,000. So it very much is tracking the red line. Going to Germany, same process. I'm going to skip to the answer. We had 1,466 cases, slightly fewer than France. I predicted at day 16, as March 16th, we would have between 4,500 and 9,000 cases. We have over 7,000 cases. So this is between the two lines, but it's tracking more closely with the blue line, which is the 10 days of data. So it's not true that the shorter model is always superior to the longer model. It seems to vary place to place, but both models seem to be not horrible. Norway is an interesting example where you can see something different is happening. You look at the increase in cases, and it's fairly linear, and then it sort of starts to curve, flatten out here, and we see that in the cases here. So given what was going on early in the epidemic in Norway, when they had 400 cases, I thought they would have between 3,000-ish cases and maybe 3,300. And in fact, you see in these last few days, the number of new cases that have been confirmed has gone down dramatically. It's not that the cases is going down, it's the rate at which those cases are increasing is slowing. And so they've only now confirmed 1,300 cases, which is much better than the 3,000 or so I predicted. So in Norway, for whatever reason, there seems to be fewer confirmed cases than I would have predicted a week ago based on the rate of spread at that point. We can contrast that with Portugal, which is going the other way. Portugal has very few cases a week ago. In fact, they had 41 on March 10th. Fitting the model, the gray dots, to exponential growth at March 10th for those first 10 days, we would have predicted 160 from one model or 161 for the other model. So the models were essentially identical, whether I took 5 or 10 days of data. So I predicted with high confidence, I thought, that there'd be around 150 cases. Well, there are 331 cases as of today. So what we can see is an acceleration that's happening relative to the exponential curve. I'm not sure why that's the case. Again, it could be that there's increased testing, so we're discovering cases that have been there all along. It could be that when there was only a handful of cases, they were in a few clusters and there wasn't much community spread. And as it hit a certain threshold, then community spread started to happen and it accelerated. Or it's possible that there are infected individuals flowing into the system from Spain. Portugal's right next to Spain. Spain has 10,000 cases. It's gone up dramatically in the last week. That's a border which I would expect. I don't know for sure, but I would expect there'd be a lot of cross-border traffic. If that's the case, then you would expect potentially new individuals coming into the system and seeding new clusters in Portugal coming across from Spain. So what do I conclude from all this? Well, exponential growth is fast. It's amazingly fast. predictions from the most recent 5 or 10 days were fairly accurate. They could be biased high or low for a particular country, but they weren't consistently high or consistently low. So if you look at a bunch of countries, I'd expect on average the prediction to work out pretty well. The model is close enough that they do provide important information about the short-term rate of growth in confirmed cases. What do they suggest? From these models, I predict that in the next week or so, we will have 100,000 new cases confirmed in Europe, 100,000 cases in a single week. In China, during the initial growth of this epidemic over that several months, 2 months, they saw less than 100,000 cases. I expect we'll see 100,000 cases in a single week. There's strong evidence that that exponential growth is happening in North America and that it's at least as rapid as Europe. The U.S. has done very little testing. It's done, I think, probably the worst job testing of almost any developed nation. So the several thousand cases we have confirmed is probably an underestimate by tenfold. There might be 30,000, 20,000, who knows? It's just been poorly documented. But what we do see is a very quick exponential growth in the States. This disease spreads so fast that hospitals are unable to cope with the flood of patients that need intensive care for acute respiratory distress syndrome. This is something that if you watch the news or look on YouTube, you'll see people in Italy, physicians and public health officials warning about how terribly fast this catches on. It's been compared to a bomb, to a wildfire, and a tsunami where the cases overwhelm the medical system. There's no reason to believe that any country in this world can handle the flood of cases that will happen if we do not do something. That is true for the U.S., that is true for Canada, that is true for any developed or undeveloped nation. The only tool we have in our toolbox to spread the disease, to slow the spread of this disease, is by social distancing. We have no vaccine. We have no effective treatment. We can't predict who has it because many people are infectious before they show symptoms. So our only tool is social distancing. And by that I mean really severe measures to limit the interaction of individuals. So the alert I received in San Diego about shutting down of all restaurants and bars and nightclubs and movie theaters and restricting gatherings to less than 50 people, those are very significant inconveniences, but guess what? It's better than the alternative. And I think that in North America, at least, we're lucky that we got to watch this happen in China and then, to our astonishment, happen again in Italy. And hopefully we will lock down fast enough that we won't get that tremendous spread and such horrible piling up of cases and therefore fatalities. And that's the key message here. Take this really seriously. This is a dangerous, dangerous virus, and it's going to be a while before we get a handle on it. And what the next few months are going to be unlike anything we've experienced. I've been alive for almost 60 years, and this is clearly going to be something I've never seen in my lifetime, and probably not my parents' lifetime either. So please, I implore you, pay attention, do your part. If you avoid getting this disease, not only do you help save yourself, but you help slow the disease down, and you may save many, many other people. So it's not just for us, it's for our neighbors, for our parents, aunts and uncles, children. We have to slow this down. Thank you. You'll see more from me.